Go live. So everything is set. Grab everything. There we go. Input capture. Okay. Hopefully that's still working. What's going on, everyone? Welcome back to another weekly live stream. I am still getting set up here, but we're gonna change it up this week and do some weekly news. I don't really have any news articles lined up, but I want to share how I typically get my news and how I stay informed on current pharmacy events, public health events, and informatics events. And I'll show that in a second. Let me just get set up. I feel like I'm always in a rush or behind when doing these live streams. But okay, so what we're gonna do is typical. Just feel free to leave any questions in the live stream, and I'll get to it. But this is probably gonna be more of like a learning session for myself, where I just comb through some of the news to see what's interesting, what's not, and then if it is interesting, I'll go ahead and look into it more. But to start off, I typically get my news from two different places. One is ASHP Daily Briefing. They release like an article Monday to Friday that talks about the most pressing pharmacy news. And then the other place I get my news from is AMIA. They do like a daily digest or something like that, where they talk about things related to informatics, public policy, and then government stuff, a lot of government stuff. But okay, let's go ahead and get started. Let's see. I'm gonna start with, where should we start? Maybe from Tuesdays. I'm probably gonna spend maybe like 10 minutes on pharmacy news, and then we're gonna switch over to the informatics side because I always think that's more interesting. So let's actually take a look. So this is from what day? 4/20. This was just yesterday. So see if there's anything interesting here. So I think most people are aware of this. All individuals are at least 16 years old are now eligible for COVID-19 vaccines. So that's pretty awesome. I don't think there's anything else that we need to dive deeper. But I guess even to explain, if you've never seen the daily briefing, this is kind of what it looks like. Let me see if I can click that. And they kind of summarize the news or the most important ones that they think. They curate it, write a brief blip of it, and if you are interested, you can click on a link to go into more details about this article. But this is pretty straightforward. It's good to know when things are happening, so that's fine. Let's see, anything else? Experts say resuming use of the Johnson & Johnson vaccine will require clear guidelines on how to treat patients with rare blood clots and telltale symptoms. And I'm kind of curious how that's gonna go. So I've been following the news on this, but not too deeply. But I guess folks are probably well aware that they stopped the Johnson & Johnson vaccine in the meantime because of those 6 blood clots. And I think I recently recall that Dr. Fauci was saying they're going to resume it on Friday, potentially, based on the guidelines. So resuming, blah, 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 will require clear guidelines. Remain an important tool. Yeah, so it's just kind of TBD at the moment. I think the last I saw was that Fauci was thinking it might resume on Friday if all things check out. Following FDA requests, stops production, emergent shutdown new manufacturing, led to millions. Oh, I don't think I caught this. Let me look at this. Following FDA request, Emergent Biosolutions stops production of Johnson & Johnson coronavirus vaccine at Baltimore plant. New manufacturing of J&J at its Baltimore plant at the request of the FDA after a troubled facility last week. Said there'd be a new inspection. That doesn't look very good. I guess I'm not interested enough to dive deeper, but if I was really interested into diving deeper into it, I'll look into it. But I don't know, this doesn't interest me as much. HHS OIG warns healthcare providers to not charge or balance bill patients for receiving COVID-19 vaccine. Not interesting to me. young healthy adults who are seropositive at lower risk for subsequent infection compared to those who are seronegative. Those who are seropositive have a reduced risk for subsequent infection, about 1/5 the risk. Isn't this like kind of make sense? Like you would assume that's what would happen. Not interesting. Rapid coronavirus tests will be sold without a prescription at CVS, Walgreens, and Walmart. You know, I didn't even know you need a prescription for this. We'll be able to buy rapid coronavirus tests without a prescription. I mean, this is, I guess, somewhat interesting. From where I'm currently located, it seemed rather simple to get a coronavirus test, do like drive-through testing and everything. I thought it was simple enough where you didn't have to get a prescription or anything. I don't know. Maybe not as interesting. Okay, moving on. FDA approves new oral contraceptive. You know, I feel like nowadays I don't really care about anything that's not related to infectious disease, and I kind of skip over any new meds and stuff. But yeah, so I really like the daily briefing because you can kind of see like what's the biggest pressing news, other like highlighted specific topics. So COVID-19 in this case, there's different drug approvals. So if you're trying to keep it up to date with new drugs that are approved, you can see it there. Quality and safety. Yeah, this stuff was good back then when I used to be every single day I would be reading multiple journal articles, and it would be very interesting to see like what is the best pharmacotherapy to use for a particular disease state, so you can really optimize a patient's care. But nowadays, I mean, if it's not something related to what I do at work, I just kind of skip over it, and this is not interesting to me. I hardly deal with epileptic patients, so this is not interesting to me. Regulatory, I don't see anything very interesting here either. Research, yeah, nothing that stands out. So in this case, here it is, Monday's leading stories. So this was earlier this week. That is what I was saying. I think, let me just click into it and see. They were saying that Fauci was predicting will be in use again by Friday, likely be in use. Yeah, so we'll see how that plays out. I don't think I've heard anything about it today or anything. So let's move on actually to today's daily briefing to see if there's anything interesting there. Let's see. Today is this today? Yep, today. Okay, let's open this one up. Here it is. Leading the news. So this was today's news. With so many unwilling to be vaccinated against COVID-19, some experts say herd immunity is not a realistic goal. Reports. So this is very interesting to me. You know, this crosses public health, pharmacy, and infectious disease in this case. Vaccine hesitancy, I'm very curious about too. So let's see. Reports some experts are moving away from discussion of herd immunity with regards to COVID-19, and instead of saying control should be the goal. Okay, with so many people unwilling to be vaccinated, the possibility of herd immunity seems less likely, according to some experts. Director Dr. Fauci says, rather than concentrating on an elusive number, let's get as many people vaccinated as quickly as we possibly can. Director of Mayo Clinic says it's theoretically possible, but as a society, we have rejected that. There's no eradication point. It's off the table. The only thing we talk about is control. Yeah, I mean, I think this makes sense. I don't really have any expertise. I recall some articles I've read in the past that talked about, you can't really achieve herd immunity for many disease states, and it's different for every single disease. But at this point, it really makes sense. The focus really should be on control, especially given the prevalence of vaccine hesitancy in our country, if not the world. I think it was like one of the top 10 public health issues stated by the WHO a couple years ago, vaccine hesitancy. So it's probably unrealistic completely to expect that we'll achieve herd immunity. Oh, cool. It's Jackie. Hey, Jackie. What's up, man? Thanks for tuning in. Just checking out some pharmacy news here. Okay, let's see. What else do we got? Other COVID-19 news. European regulators allow J&J to resume vaccine. Oh, that's interesting. So Europe is resuming the J&J. Said the coronavirus made by J&J should carry a warning about rare blood clots, but they placed no restrictions on the use of the vaccine inside the European Union. According to the Post, the decision was based on the same U.S. data that U.S. regulators last week. They will resume redistribution in Europe, but the U.S. hold remains in place. I have actually not looked closer into the studies that caused it to be pulled. I probably should. Everything that I saw, the most recent stuff I saw was based on 6 deaths or 6 clots. Maybe I'm assuming they were deaths. 6 individuals that had blood clots out of like millions of doses, and that's what pulled it. Looks like Europe, in this case, is thinking the benefits outweigh the risks. Hard work, strategy, changes required to convince reluctant individuals to get vaccinated. Has met its goal. Health officials around the country are hitting what appears to be a soft ceiling. More than half the nation's adults have gotten at least 1 dose, but it's going to take work and some creative strategies to convince the rest. Numerous state health officials, business leaders are struggling to figure out how to tailor their message, their tactics to persuade not only the vaccine hesitant, but also indifferent. This work will be labor intensive. Like my whole perspective on this is like, and this is all anecdotal. I have really not looked into a lot of this stuff right now, but just the idea of individuals being vaccine hesitant. I'm hearing that they actually have a surplus in vaccines. People are there's a lot of spots left for appointments, and I don't even remember where I was going with that. Yeah, I don't know. I'm just kind of curious what's going to happen when, or I'm just very curious how this is going to play out. It's going to be definitely a struggle to convince a lot of individuals to take the vaccine. I think that was the point I was trying to make, or I was trying to get at, was so many mishaps have occurred related to the handling of COVID-19, especially. I think it's just going to be very difficult. I have a feeling that a lot of people are not going to be convinced. And the individuals that would have been convinced before are even less likely to be convinced now because of all of these mishaps, especially with the thing with the J&J. I think it's just made it very difficult. Oh, Jackie says, what's your opinion about the COVID-19 vaccine? 3rd shot seems pretty imminent in the fall. Patients are wary about getting a 3rd shot. Yeah, I don't know. I feel very uninformed and uneducated about the whole thing. Everything I've read so far, and most of the research, when I actually looked at the research, was more so like a couple months ago. I would expect that, yes, there will likely be a 3rd booster shot. And from some of the virologists that I heard speak on this topic, almost seem to suggest that COVID is not really going away ever. It's going to be similar to the flu, where we're getting like a booster or a shot for new variants that come out every year. That seems very plausible to me. At the rate we're handling COVID and the rate of how the world is handling COVID, that seems like a booster is very likely. Yeah, exactly what you just said. It's going to be an annual thing. Everyone's worried about getting another shot. I mean, think about it, right? It's vaccines get the most scrutiny out of everything because you're giving it to healthy individuals. And so the criticism of anything related to vaccines is super, super high. The tolerance for any failures is super low. So things, when we have like the J&J and AstraZeneca vaccines having these kind of issues of blood clots and stuff, that's alarming to patients. I think a lot of it's going to revolve around how good our public health messages are to patients to say this is safe, you should get it, this is the benefit the greater public. But it's going to be a challenge. And so far, I have to say, we've done a terrible job. We have not done a good job at all. Okay, let's see. What else? Do we have anything else interesting on today's news? I have not even looked at today's news. Okay, let's see. Coalition of Health Systems to promote COVID-19 vaccine. Oh, this is awesome. So it looks like some people are working on more campaign messages, so that should help. And then the next one says US lacks comprehensive, oh wait, this is different. COVID-19 testing strategy more than a year into the COVID-19 pandemic. More than a year as the spread of variants and increasing case counts. I mean, you know what the unfortunate thing about this is? There was a change in administration during this. Completely minus the politics aside, I don't care if you're a Republican, a Democrat, or liberal, whatever you are. Changing an administration, all the leadership and all the operations and all the strategies and things in the middle of a pandemic likely doesn't help this. Obviously, it's not something we could have changed, but I mean, it almost makes sense why, this is happening. Most Americans support pause of J&J as responsible. I think that's interesting. So most Americans would support holding off the J&J for 6 clots out of like millions of doses. Finding that it is responsible, according to in the survey, 91 respondents were aware of the pause and 88% heard were being responsible. Even though I just said that, given the fact that we have Pfizer and Moderna, okay, that probably is not too bad. Let's see. Many people say J&J. It's all J&J news. Pause should not affect a person's decision to receive a vaccine. So the J&J should not affect a person to receive a vaccine, and 76% said it would not deter them from receiving vaccine. Well, that's interesting. See, some of these things, like, it's really important to look into these numbers because how they obtained these percentages and which population of individuals make a huge difference. But I'm just too lazy to look into it right now because it's not interesting enough. 63% said that people should continue to get Pfizer despite blood clot, while 37% believe that people should slow down and wait for more information before getting the vaccine. They're two different vaccines. The mechanisms of actions are very different. Pfizer and Moderna use mRNA, and then Johnson Johnson and AstraZeneca, I think, was the adenovirus, and they're different vectors. So logically speaking, if I was the general public that wasn't vaccinated, I would think it makes sense that you should not be affected by the J&J news and continue to get Pfizer and Moderna. Fewer than 40% of patients with CLL, not interesting. At least 12 viewers say they're confident of being able to vaccinate. That's awesome. That's really high numbers. 12 EU member states that they are confident of being able to vaccinate. 70%. That's awesome, man. The faster the world gets vaccinated, the better. Quality and safety, contagious, not interesting. Not interesting. Eli Lilly lawsuit, challenging judge, not interesting. Yeah, so all of this stuff I used to read all the time, like at least entire paragraph, but this is probably why I don't know anything about meds anymore unless it's related to infectious disease. Yeah, not interesting. Okay, so the other thing is so I really enjoy reading the informatics one. And let me show you guys what that looks like. I am such a proponent of this. If you are at all interested in informatics, you should 100% be a member of AMIA, American Medical Informatics Association. They do something similar to ASHB Daily Briefing, where they, let me pull one of these up. Why is this not pulling up? They publish daily news Monday to Friday, and I don't know why it's not popping up. Oh, here it is. And the topics that they talk about are very fascinating. And again, these topics intersect informatics, public health, clinical topics that are related to informatics, population health, social media, like a lot of fascinating topics. Let me show you guys today's. Where is today's? Here it is. Let me guys show you today's. And then if you guys are interested in informatics, you're going to love this. So here's today's. You can kind of see it's structured very similarly. It starts off with the top news, and sometimes it spans beyond informatics because it's just news that's really important to know. But you see clinical informatics, bioinformatics, population health, and social media highlights. So let's see what we got today. From rotten teeth to advanced cancer. Oh, I'm not. Maybe it's not that interesting. Meet virtual reality, your new physical therapist. I don't know. It's just a lot of it actually talks about technology type stuff, like improvements of that. So I think they're very fascinating. I probably would click into them to look more, but today doesn't really jump out. See, this is interesting. Is telemedicine the de-evolution of medicine? Some of these perspectives are so fascinating to hear people talking about. Having passed a year's worth of COVID-19 lockdowns, stay-at-home orders, self-quarantines, and other social distancing strategies, it is a good time to reflect on the extent to which we have shifted our lives online. We shop for groceries. Let me take a look at this a little bit more. So here's the actual article. So this was from The Hill. What's the point they're trying to make? During this rapid transformation, telemedicine became one of the major industries that forcibly advanced. According to McKinsey, 46% of consumers were using telehealth services to replace canceled health visits compared to 11%. That's a big jump. 46 to 11. We pushed doctors' office visits online and freed patients from the shackles of waiting rooms into the comfort of their own homes. While this brave new world has been deemed a good thing, it is not a panacea. Telemedicine initially was created to fill the void of medical care accessible for patients in remote environments, but it's become more about survival for doctors. Like any business during the pandemic, fewer services could be rendered because of stay-at-home orders, resulting in less income. Physicians were not immune to this model of compensation. The Canadian Institute for Health Information reported a 50% reduction in emergency room visits in April 2020. That's a lot. Dangerous scenario in which medical practices were near the brink of bankruptcy until virtual visits quickly became the norm. Although this appears to be a win-win, there is much more that meets the eye. From price wars to outsourcing to substandard care, we should consider all the unintended consequences of the telemedicine trend. Yeah, it's fascinating. I mean, at the end of the day, medicine is a business, right? You got to generate revenue at some point. I'm curious as we mature in telemedicine, what the revenue streams would look like. I probably should read more about this, but there's only a few minutes left, so maybe I'll read this at another date. But you guys should check that out. Let's see what else is interesting. Old U.S. COVID-19 hotspots are the new hotspots. States hit hard are seeing cases rise due to new strains. Someone asked me the other day, actually multiple people asked me the other day, like, it's very strange. We're in this kind of like plateau where the daily case counts have kind of been plateauing. And in some ways it makes sense, right? Why are vaccination rates so high, yet the cases are also increasing? And it makes sense because all the elderly were the ones that were vaccinated, but it's all the younger folks that are getting immunized. So, not the younger the older folks were getting immunized, but it's the younger folks that were getting the cases. So it makes sense why cases are increasing. Most of it is in younger folks. We know a lot about COVID-19. Experts have many more questions. Today wasn't that interesting. Let's see some informatics stuff. So 3 ways to begin to reduce clinical documentation. That is a huge percentage. While physician burnout saw a decline prior to COVID-19's emergence, it is still a major professional problem that demands systemic responses. As physicians navigate the ongoing pandemic, they also struggle with too much paperwork, lack of time for patient care, and poor work-life balance. Hey, anyone that's interested in informatics, please pay attention to the things you're building, and please highly consider user experience and user design. It is a huge thing, and multiple studies have shown it now, dating back to like 2019. Documentation burden is huge, and it is not good. It's a huge focus nowadays. So if you are interested in informatics, don't just build, really consider the documentation burden you're placing on your providers. Jackie says, did you hear about CVS and virtual verification? No, I have not. And to be honest, I haven't really paid attention to news in the retail world except Reddit. If any one of you are on Reddit and you look at the front page of pharmacy Reddit, it is plastered with really negative news about how pharmacists are being treated. But no, I have not heard about virtual verification. Is that just like pharmacists don't have to go in and they're verifying meds? Something like that? I wonder how that works. Like, do they counsel their patients? How do they actually fill? Is it like robots? Is it just techs? Like who's manning the physical store in that situation? I haven't heard about that though. Maybe just a couple more minutes of this. Nurses give EHR usability an F in new study. A study published this week in the Journal of the American Medical Informatics found that more favorable EHR usability scores are associated with lower odds of burnout, and those usability scores have tanked. Yeah, it's bad. My capstone, by the way, in my public health program was on clinician burnout, and it is fascinating to see how impactful it can be. And to be honest, it's debated how best we can improve it. Improve burnouts and documentation burden and all of that. But this, like, usability, clinician burnout, documentation burden, those are all very high touch areas in the area of clinical informatics. Very fascinating. What else do we got? Collaboration across the C-suite, key to implementing data blocking and interoperability rules. Oh yeah, this is very interesting here. And I might be a little biased, because if you guys are not aware what they're talking about, the interoperability rules they're referring to are the finalized rules that were published by CMS and ONC last March in 2020 that was meant to really... Oh man, I'm behind a paywall. Damn it. Anyways, it was published in March 2020. It was really meant to get all vendors, healthcare entities to speak the same language, and that same language being FHIR. It was an amazing piece of legislation that was like a couple years in the making. But the problem was COVID happened in March of last year, and so they pushed back a lot of the timelines. But that key piece of legislation is very huge. Anyone interested in informatics, that's another thing you should really pay attention to. Just like the, what is it called again? The High Tech Act in 2009, 2010 that got all of us jobs in informatics. This is like the next generation piece of legislation that's going to create jobs in this area. You should really be aware of this. Let's see. Let me see. Maybe find one more article to talk about, and then we will. Well, yeah. Let me look at the chat. I guess that will diminish job opportunities for future pharmacists. Yes, I agree with that. It probably would. Now, one of the CVS says the pharmacist was doing virtual verification, but it seemed like they were still in person, unless I misunderstood. Well, that's interesting too. And I guess that could make sense. You could have the pharmacist go physically into the store and then maybe even remote verify for multiple stores. That would really decrease the overhead and decrease the cost of staffing a pharmacist. One of my friends told me they are cutting RPH hours due to this new idea. Layoffs are continuing with the CVS community. Yeah, anytime I hear news about retail, it is not good. It's just terrible. And again, if you look at Reddit, the last couple of days have been some of the worst news I have ever seen come out of Reddit about the retail community. It's very terrible, the sentiments that are being stated out there. Okay, one more article and then we're going to start wrapping up. J&J to resume EU vaccine rollout. We saw that earlier. CRISPR, voice tech and medicine. Can reality live up to the promise? These are all things I would probably read into, especially if you're interested in informatics, just seeing where areas of tech are really booming. It's just fascinating to see where we can go with that. So, study finds 1 in 10 with mild COVID have lasting symptoms. This is interesting to me. I think earlier studies have talked about this, where even if you catch COVID, and let's say you're younger, you can have really long-lasting symptoms. And I think the long-term symptoms and consequences of having COVID is a little frightening. But it looks like this dives into it deeper. Not as much informatics, so I'm going to skip over that. Population health. Catching COVID-19 after being vaccinated isn't a myth. It happened to me. When I was vaccinated after COVID-19, I felt a deep sense of relief. No more worries about personally catching the disease. What is this? Population health? It's not as much informatics. Indian hospitals? Nope. You know what? Today's wasn't that great of a topic. I overhyped it. Usually you see some fascinating stuff. And I think a lot of the stuff earlier, maybe it's just because it's COVID right now, A lot of the things were related to artificial intelligence, and I loved reading about that. Let me just take a scan of one more real quick, just to see. Oops, let me close this. Tuesday, if there's anything super unique about this one. Billion spent, COVID cases on the rise, health 202. So this is also fascinating to me. Health 202, Trump tried to shrink Medicaid. Here's how Biden will try to expand it. It's not necessarily directly related to informatics per se, but you know, the more I study it, and this is probably obvious to so many people out there, but incentives drive everything, especially financial incentives. So healthcare policy related to things like reimbursement for medical care, like Medicaid, Medicare, really shape our behaviors and how we act. So I think how healthcare legislation gets drafted is super fascinating, and a lot of it can impact informatics in types of initiatives that are carried out and stuff. So it's an area that I'm really interested in, financial incentives and how they get drafted. COVID-19 lesson for 3 countries, nothing else. Look to the future of health. Yeah, so this stuff, like this is super fascinating, right? 3 takeaways from Chime 21. EHRs, big tech, and VCs look to the future of health. The public health and financial devastation of COVID-19 can't be overlooked, but the pandemic has created new opportunities for industry to leverage technology. So these are the kind of things where, you know, I'm very excited about, because they start talking about what the future of healthcare might look like, and why that's interesting beyond just being interesting is because there's a practical side of it. Those of us who are in informatics or in technology, these are areas where maybe you might want to invest some time in developing certain skill sets, because you could be the expert or the de facto expert in a certain area and quickly rise the ranks or be a leader in a particular area. So I love reading these type of articles. So let's see, what are the 3 things? EHR vendors eye the road ahead. Harsh light on IT failures of U.S. healthcare infrastructure, where data input and sharing can still be a manual process. That really sucks. My thoughts behind the piece of legislation I talked about earlier, the finalized rules from CMS and ONC, ideally would be a solution here to where, I guess this is data input, data sharing or interoperability would not be a manual process. But it's a dream that's high in the sky. Top leaders said it was imperative to modernize the country's public health reporting, including record keeping. There's definitely going to be a lot of manual stuff in the public health side of reporting. The infrastructure is so dated, and it is a mess, the public health surveillance systems that we have. Is there anything else interesting in here? Even entrenched powerful players shouldn't discount the influence about being amassed by companies like Amazon, Google, and Apple. They are plugged into the consumer, needs to be coordinated. Let me see. Big tech commits to open standards, cloud computing. Yeah, see, this is very interesting. I love when they start bringing in like big tech. Amazon, Google, Microsoft committed to helping build an interoperable infrastructure, noting medical software should be open to numerous researchers and facilities while interfacing with existing systems. But you also have to think, like, they have a primary motive there, right? Like, they have an incentive. It's very fascinating when you think about, why are certain people doing certain things? Why does Amazon, Google, and Microsoft want to help? Are they altruistic? Maybe some of them, but there's a lot of money in the data, and the ability to have access to the data, take all the data and put it into the cloud and mine it. That's very valuable information. So there is a huge financial incentive for individuals like Amazon, Google, and Microsoft to be involved. Interoperability is a belief we all share. You know, I'm not trying to shine negative light on them. I'm sure they mean well, and they definitely do want this. I think everyone wants this, but there is other incentives for sure. We believe in open standards. Yeah, like, I would probably read this article in its entirety, but It is 9 minutes past, and I am probably going to end the live stream because, yeah, I got other things I gotta take care of. But I hope you guys enjoyed this. I have no idea what you guys think. I've actually answered a lot of the questions that I've received recently, so I figured, why don't I do this? Take the time to inform myself of recent news that's going on, and then also share it with the community. So these are kind of like working sessions. I'll do this every week so I can keep myself up to date, and then some of you guys who want to tune in and listen to some pharmacy and informatics and public health news, feel free to as well. And we can like chat about it, on live stream. So let's see what we got in the live chat. One of my layoffs. What was the legislation from last March that you were talking about? Mike Stir Fry. That's a cool name, by the way. Mike Stir Fry. I love Stir Fry. So the legislation I was talking about, CMS ONC interoperability rules. I'm a little biased. I actually helped write part of the rules because I was an intern at the ONC. So I'm a little biased towards them. But let me see if I can find you the thing. It is, again, the biggest piece of legislation. And this is not me saying it. It is like every single past former ONC national coordinator was saying this too. This is the biggest piece of informatics legislation in the US that came out in the last decade and will be the defining piece for probably the next decade. Understanding. I wish there is like. So it's the CMS and ONC final rules. I'm trying to find one that is like one easy piece that shows what it means for providers. So many people have been talking about it since, because everyone needs to conform with legislation. So healthcare entities all over the place are trying to figure out how to align with them so they don't get penalized. So I'll just read this here. It looks like this one might have an overview. I'll share it here. Overview of ONC and CMS 2020 Final Rules on Interoperability. So in May 2020, the Office of the National Coordinator for Health IT, or ONC, released the final rule implementing the provisions of the 21st Century Cures Act related to electronic health information blocking, interoperability, and the Health IT Certification Program. Concurrently, CMS finalized its rules on interoperability and patient access. This webinar provides insights about the rules and identifies the complexities and interdependencies across major provisions. Topics from the ONC Final Rule include 2015 edition Cures updates, U.S. core data for interoperability, application programming interfaces, information blocking exceptions, and penalties, and information blocking conditions and maintenance of certification for health IT developers. Also covers several aspects of the CMS Final Rule: hospital condition participation, public health reporting as a mechanism, public health reporting of failures to update. There's a lot in the rule. I think it was like, the ONC one was like 1,000 something pages, and I think the CMS one was also like either 500 or 1,000 pages as well. But it's been a while, but why it's so important, a couple of things that come to mind is, so right here, 2015 edition Cures update, every single organization must have a certified EHR, right? And who certifies them? ONC defines the certification criteria. So the ability to share things like patient demographics, your medication history, your labs, things like that. So certain things are defined. And if you don't have a certified EHR vendor, you don't get certain financial incentives, because people who do have them get certain financial incentives that amount to like millions or billions of dollars depending on your organization size. So these things are very important to your organization. It's like meaningful use in a way. The US core data for interoperability is super awesome because they're like defining what are the core data elements that every single healthcare entity should share. So it doesn't matter if you are a pharmacy, a hospital, an insurance, an individual provider, a vendor. These are the core data elements that we expect all of you to be able to share. And on the backbone of that is APIs like the FHIR API, which is basically for those of you who are not as familiar, a language. You're basically asking all these people to speak the same language. And there's financial incentives behind it where they are saying, if all of you healthcare entities, if whatever software you use, we don't care, just speak the FHIR language and adopt the US core data for interoperability. So you should be able to adopt these data elements. This is like the framework to sharing data, and it's like super fascinating. And again, these are the things. This is where the job market's going to be for informatics. If you understand these pieces of regulation, you're gold. A lot of people right now are trying to decipher, especially lawyers, decipher what these means and how organizations can meet these criteria. But super fascinating. And then CMS was also interesting. Maybe not to a lot of my audience here because most are pharmacy, but one of the most interesting pieces of CMS was the the optimization of the E and M codes. Is it the E and M codes? Is that what it was? E and M codes? Yeah, evaluation and management codes. So evaluation and management codes are billing codes used by primary care providers when they see patients. It hasn't been updated in over 25 years, and it contributes to a huge burden on documentation. They need to based on this and based on that, bill things a certain way, and it was very tedious. Even for things like if a patient's medical history already had something, they had to re-document it or they wouldn't get reimbursed. So the CMS, part of the CMS Final Rule, completely revamped a lot of the E and M codes to allow for things that took advantage of the EHR. So things like if the patient already was noted that they had this diagnosis, then the provider didn't need to re-document it again. And it's a game changer for documentation. And I think they just started this year, 2021, calendar year 2021, using it. So I'm very curious to know from providers how they're adapting to it. But there's just so much in these two rules. I would highly encourage you all to be familiar with it. Anyways, I got too excited about that, and I'm way over time. So thank you guys again for tuning in. Tony says, do more. I'm glad that Tony likes this. This is I was just all over the place. But these are, again, kind of working sessions where I'm learning myself, so you can see my thought process as I'm reading through these. And then please feel free to share any pharmacy, informatics, or public health news that you guys might have on your side. But okay, guys, thank you guys for tuning in. I'm going to do these every week, see how they go. And if you guys like it, we'll keep on doing it. But I'll see you all next week. Bye.